Good evening. Good evening. How are you? How you day? Welcome again to another session of Ask the Doctors. My name is Dr. Frederick Unubohai, and this now Ask the Doctors, a 1 hour online health program where we dey follow you talk, we dey follow you relate. This program now every Sunday, 8 p.m. West African time. Yes, and we don't dey do them since they come. No be only me they day here. Me and my colleague they always day here, Dr. Israel, and Dr. Israel day here. So today's session now question and answer session today. Today, if you get question for us, you go ask us any question where you get. But before we start to take your questions, tell me where you they watch from, where you they watch me from, and then share the live. Very important, share the live, and no forget yeah, now questions only we they take. We know they prescribe medicine, we know they give drugs, we know they treat online. Very important, Abby. Very clear. So tell us, where are you watching from? Dr. Israel, good evening. How you doing?
Good evening. Happy Sunday, everybody. Happy Sunday, Dr. Fred. You're
Yeah,
all
happy
welcome
Sunday.
to this episode of Ask the Doctor.
Yes,
Uh,
so
and as Dr. Fred earlier said, today now question and answer. Ask all questions, if medical questions, we will try give you answers to them. However, answer what we will give you is not to treat you. So most of our answer we go still end up by telling you people to go to the hospital.
yes, so very, very, very clear. Okay, welcome. If you did hear me, tell me yes, I did hear you, and tell me where you did watch me from. Share the live, very, very important. I beg, if you did watch this video after we don't end, we no go fit respond to you because I notice say some people after we don't end this live stream, now that time them they watch them, they will come they drop questions, come back and say we know they answer them. Okay, so we get somebody here. Good evening, Pascaline from Cameroon. Mary Queen, happy Sunday. I'm watching from Togo. Wow, how is Togo? Yeah, yeah. Oh yeah, let's go. Share, share, share. Now we don't start. You won't make a sharp, sharp. If you get questions, ask us now. No be say when we won't come end. No be say when we won't come end, at that time you will come they ask us. That time you come they ask us questions. Hmm? Yeah. Good evening. Welcome. 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 Happy Sunday. Okay, I don't get question here. Okay, I see. Nobody they ask us today. Oh, everybody they look us. By the time we come say, we want to close. And then you come here. No, don't go. Don't go. Don't go where? I will go. Okay. Waiting the happen. Why network they do this to me? Pascaline, talk to me. Mary Queen. Mary Queen Alpha, talk to me. Talk to me. Nobody is dropping comments here. I know they see the comments. What's that? What was going on? I mean, no, they see
Yeah,
the
nobody is
comments.
dropping comments here.
I know they see the comments. Okay. Oh, let me check this other part, this other platform. Be like I say today, now gist will come the gist. Very good. Let me see. And do I have a comment here? I think do I? Okay, these people, these are the comments I see on the screen. Are them. Ask now. Before later, person go talk, say, I want to private chat you. No private chat. Oh, rejoice. Rejoice, I see you. Share this live, guys. 11 people they watch. Rejoice, how you there? Igwe Victor. Okay, Dr. Israel. They hear me. We get one question here.
Yes, I dey hear you.
See this question here. Please, doc, can ulcer patients take ginger? And secondly, can he or she still drink clove mixed with bay leaf?
Okay. For me, I want to answer this question based on me because there are some things when every doctor like for himself. So for me, I'm not a ginger person. I'm not a ginger person. So most of the time when people talk about ginger, I look it so strange. I just feel it like, what's this person talking about? So for me, I'm not a ginger person. So I know it. So most of the time, if you know say those things when you take, anything you take will trigger your ulcer or will make you feel uncomfortable. And I think that's the best way when I'll answer that question. If you think say when you take your ginger or your clove mixed with bay leaf go cause you go make you dey uncomfortable, it is better you don't take them instead of troubling yourself or in the name of they try to solve one other problem or not. So I think it's better you don't take them than to cause yourself problem. Dr. Fred.
Yeah, thank you, Dr. Israel. Make I add on top. This person will ask us, Mary Queen, please, with regards to ulcer, anything where you know we will cause you problem for ulcer, we will give you heartburn. Eh? The advice now say make you avoid them. Anything will disturb you. So if you get ulcer and you know, say ginger, bay leaf, your spice, whatever, any type of food will give you heartburn, leave the food alone. But if you know, say, they give you problem whenever you take them, go ahead and take and eat your food, live your normal life. Is that okay? Now the advice be that. And now for those, and Lucy, how are you? Lucy, I see you. Good evening. If you just they come, welcome. Two things we want to tell you. Number one, I beg, help us share the life. Share, invite your friends. Number two, if you ask us for medicine for here, we no go prescribe medicine for you. We go ignore your questions because we know they do them online. We know they prescribe medicine. I beg you. Here, no be clinic. Here, not just to interact, give you advice, and tell you to go and see your doctor. Is that okay? I beg. So that me no be actually say we no want to respond to you. Hmm? Okay, we get question here. This question talks say, Doctor, your advice, please, can someone barb his hair, the one in the chest? Oh, okay, the hair on your chest, whether you want barb the hair daily. Okay. Dr. Israel, please respond to this. Okay, Dr. Israel, no respond in network. So my
Okay.
brother, what can I advise you
So
with this? Okay, go ahead.
okay. Say this barbing okay, might I use the word barb now, or it's supposed to be shape of the hair for body, chest, leg, or every other body. Most of the time, it depends on the individual as well. It still depends on the individual. So when you want cut your hair from your chest, it really not get anything when you go do for you. Whether it not go cost you anything. So if you like to barber, you are free, but just know say it go still regrow. Not be say because you barber say it don't come out, it don't come out. No, it go still regrow. And if you be the kind of person where they get bumps, all those small cro when hair they grow, eh? Anything fit happen. Fit dey expect say you fit get all those kind thing as well. But if you know say you don't have any problem with those kind of things, so, and you want barber, all na just for, would I call it, okay, may I not call word when I not supposed to use now. So but all na just for your own good. If you want to, no problem. If you don't want to, you leave it.
Okay. Dr. Israel, don't answer you. We get another question here. He said, Doctor, why drug someone they get palpitations after taking drugs? I mean any type of drug. Igwe Victor. Igwe. So your question talk say, whenever the person take any type of medicine, Abi, the person they get palpitation. Are you sure? You know what palpitation mean? Because if really you know what palpitation mean, and the person take any type of medicine and they get palpitation, only when he take medicine, and that person must see a doctor, because it dey totally abnormal. See person go take medicine, the heart go come dey beat very fast. Palpitation means say they hear your heart beat. Do you understand? So that person need to see a doctor. They will check him, they will examine him, they will check in hearts and find out wetin dey cause am. Yeah. But Israel, you want add anything?
However, you not fit just dey take any drug they get palpitation. That's
Very
one
true.
thing we still also need to know. You cannot be taking
Yeah.
any drug at all. They get palpitation. So if you notice they get palpitation, you have to try to know which drug you take. And if they get palpitation, go see your doctor. It means say there are some hidden things when your doctor need to find out as symptom, sign, treat. So
Okay. We get question here. This question talk say, Doc, how do someone know if he or she have liver problem or kidney problem? So Israel, you want to respond?
okay, they get so many signs and symptoms where you go fit in know whether you get liver problem or kidney problem. However, some of the signs and symptoms when you go see fit be the same signs and symptoms for other diseases. But I know fit want you tell you some very straight signs for liver, mostly liver, because once you don't get those street signs for liver, it means say your liver don't go far. So it is better that sometimes you do some investigation to just check yourself, check your liver function, check your kidney function. It not go cost you too much. Now for the kidney, if you notice say your in the month you this.
Oh my God, Dr. Israel, what's they happen? Your network, Dr. Israel, your network they break. I don't know what happened. Okay, so let me I continue from where Dr. Israel stopped. You say how you go take no. Sometimes in the beginning, some people will get all these problems and they no go know, say they get problems for their liver or their kidney. They no go know. You go there, especially for the kidney. Now, because these organs, then get power very well. They feel they help you to work, but problem they go on there. So usually after your network, is it back? So the
I'm
problem
back.
the thing where they go on.
My network never once spoil. Now just that I come up for life. I don't know how.
Okay. Continue quickly. Let's go to the next question. Continue.
Okay, as I was saying for that kidney. So when you can notice say you dey piss you dey piss and your urine dey foam well. You feel they think say problem don dey dey. Then your leg can dey swell. Your two legs they swell. You know say problem also don dey dey. Or you can notice say your hand, your leg, all of them they white one kind. Or your body can swell. If it be say you don't get
Okay, we get another one here. Please, doc, what causes bloated stomach during ovulation and also making one feel feverish? What causes bloated stomach during ovulation and makes one feverish? Okay, let me make I respond. We don't get so many questions. May I respond?
Okay, Dr.
So
Fred.
yeah.
Hello, Dr. Fred.
Now, okay, Dr. Israel, join back when your network is okay. So there are many symptoms of ovulation, madam. Ovulation get many symptoms. I don't know whether you just dey follow my page. Some of this, one of the symptoms of ovulation, we say the woman body feel they feel hot. Just for that period, your temperature feel increase. For some other women, their belly fit con change, maybe e full. Some go get abdominal pain, some go get their sense of smell go increase. Do you understand? So ovulation get many symptoms. No be say you go dey feel feverish. If your fever, your increased body temperature continue for long time, then you go need to speak with your doctor. That one no be ovulation again. Do you understand? But woman get many signs of ovulation. I go advise you try watch my video on ovulation. Yeah. Doctor, can garlic, cinnamon, ginger, black seed burst ovulation? What do you mean by burst ovulation? I don't understand. What do you mean by burst ovulation? Good evening. Welcome everybody. Let's see. Share the life, share the life. Doctor, apart from family planning, can a woman remove her womb so don't conceive again after giving birth to all the number of children she wants? If yes, does it have any side effects? Millicent Prince. Well, this decision, before they will come out any woman womb, they will explain to her the procedure. They will tell them anything if it happen. Nobody will just go open you and come out your womb like that. Other method they. But yes, if it happen, they fit do one for a woman. Say the woman just say she want come out. They fit do one for a woman. Nobody say they no fit do one. But before they will come out, your doctor, your gynecologist could break down so many things for you. Your age, your medical history, all of them. They go put them into consideration. They go analyze them. Can't tell you say if you do one like this, problem no go dey. Oh, if you don't like this and this will happen. If you give you this medicine, do you understand? Yes. So if you want really do the gynecologist, the doctor, the specialist will go do for you, go break down everything for you. Dr. Israel, let's take this one. Doctor, please, why is it that even if someone treats malaria and still go to lab, he or she must have malaria? Sometimes they will write 1 plus, 2 pluses, 3 pluses, or sin. Is it possible that person fit do test and not get malaria? Dr. Israel, please.
Yes, yes. Person fit do the test and you not get malaria. Sometimes, before now make we they say treat before you treat malaria, you need to do your test. Because sometimes you people fit not go take malaria drug and not be malaria you get as at that time. So when the malaria come, when you see go do the test, it go show. And another thing you should know is that even though you treat malaria this week, and you still dey infected with a mosquito wey carry malaria still bite you, and all the process still occur within 1 week, that is by next week or next 2 weeks you still go do test, you fit still dey fit still see the malaria for your blood. So because the treatment wey you treat na for the previous malaria wey you get, and the test wey you do na for the new one wey dey come. So that na one. Two, if you see be say person wey dey do the test just because he want collect, he want me treat you, make collect him own money, fit just tell you say yes, malaria dey. That na two. And as I earlier said, yes, you fit do test and they not go see anything. We don't do many tests and we not in some cases we've done so many malaria tests and we not see anything. So it is possible.
Very possible. Okay, see this question here. Please, doctor, I have been having itching, and when it starts scratching, it will be swelling up and it swells both my eyes, mouth, hand, leg, and many places. I have taken drugs and it will go inside and then 24 hours it will come out. It's now up to 3 years I have been experiencing it. Please, what can I do? I have, let's see. Okay. So your comment says, I have watched my food, changed clothes and environment, but still yet it still occurs. Okay, Israel, what you go on advise this person?
Well, I still think that she never forgets the real thing when they cause wetin she dey get. And for you to be well treated, maybe when you dey get these symptoms, carry your body like that, go hospital, so that make the doctor really see how the symptoms really be. Because sometimes when you don go hospital, when everything don calm down, the doctor fit just dey think in one direction. But if you go with all your symptoms, maybe as the swelling and all that, the doctor may also think in different direction. But the direction wey me dey think about now is that you may be allergic to something, and until you fit get wetin that thing be wey you dey allergic to, you may be having such swelling sometimes. So one way wey you go fit know wetin you dey allergic to is when the thing start, try to remember wetin you do finish or wetin you do within that period before you notice the itching. Even though your body never swell, before you start to dey notice the itching, wetin you do last. So if you fit remember those things that you did last and you are able to pick them one after the other, you'll be able to pick out wetin you dey allergic to. So for me, I believe you are allergic to something. And don't be surprised that some people are allergic to a very funny things that you'll be shocked that they are really allergic to those things. And one of the things when you dey shocked say people dey allergic to na sun wey dey shine for up. Most people dey allergic to am. And for this country, we may not even know say person dey allergic to sun because sun dey everywhere. But yes, some people dey allergic to am. And so I just say make I give you that one as instance. So if you get some pets around you, you may just be say you are allergic to those pets as well. If it not be your own pet, if it be somebody wey dey close to you na get the pet, but because e dey within your environment, you may just be allergic to it as well. Also, you think you fit be say when you wear one shirt and you pull am, you think say e never dirty, you can't wear am again the second time. If it be say na im dey cause am, you just see say you just can be allergic to something, and na that one dey cause am. So it is for you to work with your doctor to one, find out wetin you dey allergic to, and two, try go with your symptom to the hospital. Make them really see how e dey do you, then they go really know what to do for you.
Thank you. Quickly to the next. Okay, this one says, let's say this one says, any side effects of vasectomy for men? Side effects. And the only side effect we say the man no go born pikin, according to science. I don't know what any other side effect.
Now, vasectomy na to stop the man vasectomy na to stop the man for giving birth. It's just a permanent way of family planning, just as the woman take they remove the womb. And so vasectomy still be. The only thing is that when the man do the vasectomy finish, when we want to talk about side effect, we talk about during the process of doing the vasectomy. There might be injury to some. They might not be saying a compulsory thing. Injury and the feed day, bleeding feed day, infection feed enter, and that one are during the surgery and maybe immediately after the surgery. So all those are just the simple side effects, or some side effect. Man, not call them simple. Some side effect when you feel sick for men when you just do vasectomy newly. So erection go still dey. So may not say because after vasectomy the man no go get erection. Erection fit still dey. So no fear for that one.
Doctor, can garlic, cinnamon, ginger, black seed boost ovulation? Okay.
Okay. Ovulation, make I just tell you something. Ovulation occurs in a woman once in every cycle. Ovulation occurs in a woman once in every cycle. So It means that ovulation occur in a woman 12 times in a year, most of the time, or 11 to 12 times in a year, most of the time, because it's once in every cycle. So
That is for
I
those
don't understand.
that is for those with 28-day cycle, around 1 month
Yes,
cycle, like that.
yes, regular cycle for those with regular cycle. So it's all about your cycle that will that will bring about your ovulation. If there is an egg, there will always be an ovulation. If there is an egg, there will always be an ovulation. So taking garlic, cinnamon, whatever. I just think
Uh,
if you need your ovulation to be boosted, go and see your gynecologist. He will know what and what to do for you, and that will help you better.
so make I add garlic, cinnamon, ginger, black seed, all these now normal things wey people they put for their food. If you believe or you feel say you know they ovulate, listen again, abeg. We would always tell you, you need to really know why you know they ovulate. Because how many garlic you want chop, how many ginger you want chop, how many cinnamon you want chop, how many black seed you want chop. Do you understand? People go tell you, if you go to Google and you type food to boost ovulation, you go see many things. You go chop all of them, yet ovulation will they look you like that. That is if you know the ovulate. But if you know say you know the ovulate, you must know why you know the ovulate. And again, many things wey fit make woman know ovulate. Many things dey wey you need to know about. So this one, I doubt if it will help you. Yeah, that is if indeed though say you know the ovulate, because some people fit dey ovulate and then no go know say then they ovulate. If you just dey come, welcome, share the live stream, share and invite your friends. Please, doc, is there anything called shark teeth in children? If yes, what can be the cause? Shark teeth they exist, e dey. Now when the permanent teeth they grow and the other one never come out together, the temporary teeth still dey, the other one they grow there. No need to panic, they can handle it. Calm down, no be sickness. Just relax your mind. Shark teeth, now the name, no be say because they call am shark mean say the pikin go be shark. No, meaning say the milk teeth, the temporary teeth never come out, the other one they grow there. Do you understand? They manage them, no need to panic, calm down. If after that one grow, that temporary teeth fit come out. If you no come out, you fit go hospital, they fit help the pikin. Doctor, please, why is cervical cancer vaccine so much expensive, up to 25K, they told me? Well, quickly make I answer. I don't know if Dr. Israel get anything to add. I think you are lucky. 25K dey cheap. The one wey person tell me now 30,000 naira, I be 35. You know, when I did radio, I talk about the vaccine. Somebody can send me a message privately, say then get to, but their own at 30,000 naira. I no just comment, I leave them. The reason maybe so many things they involved. Number one, the vaccine no they common, they are available like that. You understand? If you say they are available, many companies they produce them if they cheap. So today, 9 be one reason. So when there is scarcity, demand go high, price go high. Dr. Israel, any comments?
Yeah, I think you have said it. And another thing I think is because when something not the two have not to get another I want to put not the two affect, they very scary to everybody. They're not go produce, they're not going to put interest in it. So the vaccine when go they come out in that aspect, go they small. And you also mostly remember saying this cervical cancer vaccine, they very effective for younger ones than those who don't already they exposed. Now to go to do your pap smell and they check yourself. That one and they very, very important. I believe saying because they know they produce more of the vaccine, now make and they expensive. And many organizations not support, not back the sponsor the vaccine. So this to tell you that vaccine normally, all vaccine are very expensive. The thing where they make some vaccines they cheap or some vaccines now free now because they get sponsors already. So those vaccines will not get sponsors, you will notice say most of them they very, very expensive.
Okay, doctor, please, what is the cause of throat golia? I don't know what this is. I have no idea. Dr. Israel, do you know what this means? I don't know. And
That
I
Golia,
don't
I
know.
don't understand. What
I don't know
if you have
what is.
another word for that? Please let us know.
I don't know what in the throat golia. No vex. Should someone treat infection after having miscarriage? So quickly, there's a video on miscarriage for my page, 1 hour. What's be your name? Chidima. I go advise you, may you go watch them. Do you understand? That video, now a video with a consultant. Everything about miscarriage, almost everything about miscarriage, did that video. Why are they telling me you go there? Make you no go listen to beer parlor talk or market women talk, so that you go really know what in the miscarriage, what in the cause them, and what to do about them. But if now for treating infection, you would not treat infection like that unless it is confirmed say there's a high chance say you don't get infection or you get retained products which will give you infection later. Okay, Israel, anything to add?
And that's it. If you not get infection, there's no need to treat infection because many things they will go cause miscarriage.
Miscarriage.
So
Yes.
not just think say an infection.
My
Now when they
infection.
say yes, there's an infection, now that time you go treat infection.
Very good. Okay, no, not this one. Okay. How can one treat hormonal imbalance, sir? Dr. Israel, please respond, I beg.
Okay, to treat a hormonal imbalance, you need to go and see your doctor. You need to see a gynecologist. When you see a gynecologist, it will take you through the process of treating hormonal imbalance. Thank you.
And if I may add, listen carefully. You can only confirm, say you get hormonal imbalance from a medical doctor. No be Facebook or Google. You confirm. Your doctor go see you, go take your story, your complaint, will examine you, will carry out tests for you. You know, if you just wake up and think, say you get hormonal imbalance, because I dey see so many women for so many groups could just wake up, you get hormonal imbalance. That is not how it is done. So unless you don't see a gynecologist and they don't confirm I'm saying a hormonal imbalance you get, then they will tell you how to treat them. Sure, you understand? You don't treat them. To know more about hormonal imbalance too, I also made a video on that. Try go watch the video. Make it guide you. Make it guide you. No, it no go treat you. May it guide you to know why we want me you go see a gynecologist. Huh? Yes. We have how many more minutes? 20 more minutes. Doctor, is it good to add garlic to our cooking? Okay, ginger, garlic, is it good to add to our cooking? Dr. Israel, please.
There are spices. There are spices. If you don't react to them, there's no problem. You can add it to your cooking. And if you not get phobia for them, you know they fear them, you are free to add them to your cooking. They are spices and they have some medical benefits as well.
Okay. Doctor, is 22 days cycle irregular? No, 22 days cycle is not irregular. 21 to 35 days, 9 be the length of a menstrual cycle. Some women get 21, some women get 30, some get 25, some get 28, some get 32. Do you understand? So 22 days cycle no be irregular cycle. This one says, after taking medications, ginger, etc., yet my sore throat refused to go and it comes along with dry cough. Please, doc, what can one do about it? So Israel, please respond.
Okay. And you know, when you don't take many things, it is not very difficult to even tell you what to take. You know, what will be the reason? Because even when you go hospital, they'll go first think because you don't take many drugs and many things. So, as we earlier say, we know they treat person for you, and we know they tell you drug to take or whatever to medication to take for you. So I go still advise you. You have done self medication yourself, and it not work for you. So it is now time to go meet experts. May they treat you. So go hospital, meet a doctor, make it take you through some process. You may end up telling you to do some investigation. You can just do those tests and you find out one thing where they really cause your cough, and then it will treat you. And if it be say this cough where you get, if not be waiting you need medication for. If it be something where you need to change your environment, change some few things by yourself, it will still guide you through those ones and let you know what to do. So you need to see a medical doctor for that.
Yeah, let me take this question. This person sent this question with stars, so I will have to take this question. No vex. I have to take this question. So she sent this question and together with it with stars, Facebook stars. So I'm taking the question. Thank you for the stars, Ngozi. So I see the star here. Is the malaria vaccine out yet in Nigeria? And can my old man of 80 years above take it? Dr. Israel, please respond.
Okay, and the vaccine is available in Nigeria. They are proven say
It never enter.
they are proven say we go it go enter Nigeria, but I never hear say it dey Nigeria now. I never see am for anywhere.
Yeah.
But they don't approve and say we go they take am for Nigeria. However, they get age range. For now, it's still for children. The one when they talk is still for children. From 5 months to 2 years. Now they talk for now. Until I remember I said something, and when we do malaria stuff in the last week live session, I said something. I said we talk about this vaccine also a little, and we said that now this vaccine your new come, so there are still so many studies, so many things to be done about it. So for now for children and they talk, they never really put adult age for the to take the vaccine. Maybe before this year end, they fit come add adult age join am, but for now na just for children, and the age for children na till 3 years.
5 months to 3 years. Please, how can I stop spit? Is that spit? I'm pregnant and it's too much. How can I stop? Dr. Israel, what can you advise this?
Okay, there are something when it comes to pregnancy, madam. Sometimes there are some things you just have to be disciplined about it. You will not get one drug or one advice to give you, but sometimes if you have to choose something, it may help you to reduce spitting often. You fit get something for mouth make you chew. It will help you reduce spitting often, but it not mean say it will stop you from spitting. It not mean say it reduce the spit wey dey your mouth. It's just that it prevents, when something dey your mouth, it go make say those saliva wey you suppose throw away, they just dey one side. So now only that I think I will feel advice. So you can just have something in your mouth that you will be chewing to help you prevent you from spitting often, but it not go stop your spitting as a pregnant woman.
And not be every woman go spit. Some women go get belly, they no go spit. Why some go spit? After a while, the spit will stop. After a while, for some people, it continue throughout pregnancy, and sometimes too now because of hormonal changes. Most when woman get belly, hormones for our body will change. So some of this reason are because of the hormonal changes. Yes. Doctor, what causes stomach disorder? Your question is not clear, please. Stomach disorder. Stomach disorder. You can never finish talking about stomach disorder, madam. You can talk stomach disorder from now till thy kingdom come. So your question is not specific. What exactly do you mean? What do you mean by stomach disorder? I don't know if
disorder you change everything.
Just spoil them. So waiting be your big question. Stomach disorder, you're not trying to help us. Just talk exactly how you be. We go understand how you be. That one day okay than trying to say stomach disorder are more than 1,000. Okay. In case that would help you, stomach disorder plenty. What can one good evening? What can one eat to avoid cancerous cells from growing? Before I go hand over to Dr. Israel, please, are you asking for a specific cancer or cancer generally? That's number one. Because why they ask me say somebody if he get cancer now, they will come talk say no chop this thing. Now that one you they ask, or you they ask us cancer generally? the two day important. Make we know. Care why I ask, but make I hand over to Dr. Israel.
No, I think you need to first clarify that before we go free answer anything, because when you talk about what can I eat to avoid cancer, there are some things for a particular cancer. When we say if you eat and we go say if it cause, and most of the time there's no. I want to say there's no specific in quotes. There's no specific thing to say this is what you should eat to
Eat
avoid
or not? Yeah,
cancer.
yeah.
There's no specific, because even the cause of cancer, to some large extent, we still dey try to find out how. To some large extent. So there are some cancer that we. Dr. Fred, you there with me?
I dey hear you.
Okay. There are some cancer that you may not even be able to say, now this one be the real cause. And there are some cancer when they suspect say, now this because this one didn't there, now make the cancer happen. And so it will not you get one serious say now this one. So there's no specific food we can actually tell you that if you eat this one, it will cause cancer or it not will cause you cancer. So just eat your balanced diet and be fine.
Stomach cancer. Okay. Even at that, stomach cancer, if person gets stomach cancer, you know, say the symptom, one symptom be say the person if he gets severe stomach pain, for the person to chop, it will give him problem. You understand? That make I ask, it will give him to chop. So if now because of the food to chop, any food go give him problem. No be saying that the food go they cause the cancer, because the cancer did the stomach. Do you understand? So any food the person chop, if he give the person, it no be by avoid this food or avoid this food. I don't know if that helps a lot. This is why we ask you the type of cancer, because if now stomach cancer, anything the person chop, it could trigger problem, pain, abdominal pain for this person. Okay, how many more minutes do we have? We have about 16 more minutes, and then we are done. Oh my God. Okay, I did go up now, find more questions quickly. Okay, this one says, what is the best solution to erectile dysfunction or quick ejaculation?
Dr. Fred, answer that one. I think you've had a video on it.
Yes. You need to understand what they ask. Whenever people ask us question, we they try confirm if you really know what they ask, so that we could not ask another thing there. So this question when you ask now, two different questions they ask. Erectile dysfunction, they different from quick or premature ejaculation. Erectile dysfunction means say the blockers. I'm using the word blockers deliberately. The blockers, he know they fit stand, or when he stand, he know they fit stand for long. Erectile dysfunction. Quick ejaculation or premature ejaculation means say the blockers they stand, you know, get problem with standing, but immediately the man starts to get in business, or even before he enter, he don't release. These are two different stuffs. So what exactly are you asking? It clear be no clear? Okay, but I don't make video on I think I made the video on erectile dysfunction. I think so, yes. Okay, please sir, talk about pneumonia. What about pneumonia you want to know? I beg, tell us quickly, no time. Dr. Israel, please, doctor, what is the cause of regular body pains?
Regular body pains depends on the work when you do. The work when you do fit cause body pain. If you are doing a stressful work, it will give you body pain. If you also malaria, some illness will give you body pain. So I think those are mainly the cause of regular body pain, and the kind of work you do. If you say you sit down where if it give you waist pain, leg pain, back pain. Also, if you they carry heavy load, the PC give you body pain. Then the way you sleep, the position you sleep on your bed, PC give you body pain. So all these are things that can give you body pain. And if somebody they sick in nowhere, you also get body pain.
Yeah. Not sleeping well. Your foam. Your foam. If you know they sleep well for night, the kind of foam they use, if you get the problem. A lot of things can cause. Doctor, please, what is the cause of goiter? Is that goiter? Case cross. Is that goiter? If not goiter, so Dr. Israel, maybe the
I
causes
think
of
now goiter.
okay.
Okay, if we say now goiter, we will talk same. For goiter, I know now I'll make it simple, but to get one hormone when the body, what they call
Thyroid,
tyrosine,
thyroid,
eh?
thyroid, yeah.
Thyroid hormone, now what they call on the thyroid hormone. So if there's a problem with the thyroid hormone, whether in many too much or in not many again, it go give you goiter. So anything will go cause any problem with the thyroid hormone, whether the one from the brain, because it get the 3 levels, when the thing fit affect, so they cause goiter. If it affect the one when they stimulate the thyroid to produce the hormone, and if it be say the thyroid itself fit get problem wey be say e no go fit produce the hormone, or if it be say there is one tumor somewhere when they mimic the thyroid, they produce too many of the hormone, so all these things fit cause goiter. And goiter no be one small thing. So when person notice say e get goiter, make e abeg go see go see doctor, so that they can there are, for some cases there are some medications they can take, while for some cases, if na the one wey dem say make dem do surgery for am, they go do surgery for am.
Okay, this one says, doctor, she should put ginger in her mouth. Okay, not chewing it, but bite it at times. I experience it and it works. Thanks for okay for the pregnant woman where they spit too much. Okay, for the woman where they spit too much. Yeah, I've seen some women they put ginger. They go just put it inside their mouth. Maybe it will help them. But this one, if you don't do it no work for you. You discuss more with your doctor. For the stomach cancer, how can the cells stop growing, madam? Listen, I don't know. Cancer is not malaria. Please, cancer is not malaria typhoid. It's a very big business. If you have anybody with stomach cancer or any type of cancer, you have to. I don't want to make it look like a death sentence. Compulsory. See a doctor that treats cancer patients. Then get medicine, special medication where they give people get cancer. But say you want to stop the cancer cells from growing, we don't get any other thing to tell you other than medical advice. You have to speak with the doctor and they will tell you the kind of medicine to take. To stop them, I don't know. I don't know if Dr. Israel get anything to tell you about this.
Well, cancer cell mean say the cell they grow crazily. It means say e don beat all the normal natural way to stop cells from growing. So when you don't beat all the natural way, all the normal way of to stop cells from growing, there's nothing we can do about it. So the only thing when they fit do now, all those cells where they grow anyhow, we go try control them with style. And those are another one and the doctor where they treat cancer go fit do for you. So if you have anybody like that, please, it is better you take the person, may go see doctor, may they treat am well. Also, sometimes if the cancer never too, because there are stages of cancer, if the stage is still very small, they fit do surgery for the person, they remove that part of the cancer, that part where the cancer dey, and that one fit hear my word, fit help the person. E fit help the person. When they remove that one, they'll still give am some medicine. No, not be say they'll just remove that one and say the person make it go. No, they go still give am some drug to help the person. But e get where the cancer go reach, and na to just give am some medication. Those medication are just to help am to make sure say e still live healthy for some time before God go call am. So that's how it is for cancer. So I know I'm going to two paint the matter front and back. And the thing is, just go see your doctor, and it would give you the best treatment that he thinks is the best for you.
We have less than 10 minutes more. Doctor, please, this malaria vaccine, how much to it? No idea. Eh? We don't have an idea of the amount. We don't know. No vex. We don't get any idea. When it come, they will tell us how much it be. This person says, doctor, please, I was getting lean. Then I went for test. They said that it's throat goiter. Please, what is the cause? Oh, you see why sometimes it's no good to the give. You need to know how you take get your diagnosis. Please, I beg you, Mr. Kes Cross or Madam Kes Cross. If you have a medical problem, you know they okay. Tests, going to do tests is never, with every sense of humility, is never the first thing to do. If you feel say your body no dey okay, going to do test, I repeat again, is never the first thing to do. I beg you. The best thing to do, you have to discuss with your doctor first. Test na maybe the second step or the third step. Do you understand? So I don't know what an goiter you get, with what you have said. I know great and goiter you get, unless you don't follow a medical doctor talk. The medical doctor don't examine you. He don't come send you go do test. You can't get results. The result can't come back. Can't show say now goiter you get. Oh fine. But if no be goiter, they will tell you. So please stop the habit of wanting to go and do tests to find out what they do you. You know fit, and you know be doctor. You know fit. Trust me. Dr. Israel, add to this quickly because of time.
Okay. I think you said it. Just I think now that one will tell most people tell they get it wrong. You go do the last thing, sometimes the last thing before the first thing. We don't already, I think if you were here, we don't already set up what if it cause, what if they really cause goiter at first. So if now you see they ask us, our advice now, go see your doctor. Your doctor, if you reach where your doctor dey, he go tell you what if it cause goiter. And the funny thing is that most of the question when some people they ask here, now to find out whether they do those things or whether they get those things to come sure. And no, we as we earlier said, we are just here to educate you. We don't want to treat you, because the next thing, if anything we say tomorrow now, the next thing when this person will go now, you'll go find go content on the drug when you go back, because it can't think say yes, all these things with that doctor I get, and so now really got I get. So please go and see your doctor so that he will plan you, will plan your case very well and give you the best treatment.
Okay. So many questions here. We have to round up very soon. I am having chest pain since a year. The bone they make me what? I don't understand. My doctor said I'm having inflammation called costochondritis. Have been used so many antibiotics and injection. What caused it? What is solution? Dr. Israel, I beg, respond.
Your doctor won't tell you, should tell you the causes. And I think if it's what you said, does an effective word, it's like an inflammation. So whatever infection antibiotics you are using should have worked for you. And in the second thought, you also need to see an orthopedics doctors when they specialize in bone. So they will be the best person to tell you.
I was saying, may you see a chest physician, a respiratory physician. If not chest, what do you
because
think?
what is that for there? That posto na the rib now.
Inflammation of the ribs now. Yes. Inflammation.
Those are the ribs.
Like the pleural now. Pleural around the ribs.
Yes. Okay, yeah. Okay. So you need to say respiratory doctor. A doctor where they specialize for chest. Maybe if they have anything to do with the bone, they may invite the bone doctors. they may invite the bone doctors. And also, if it be say this thing na allergic issue, just be rest assured that they go only they give you medicine to just the suppress am. It will not be the no cure for it. I know they say I'm not just saying if it's an allergic stuff, if na something, if na allergy cause am, so they will just they give you drug to they suppress the allergies, or you just look for wetin they cause the allergy and run away from it. So that would be the best way to solve your problem. But your doctor should be the best person to tell you the causes, the causes, and is also being the best person to give you the
Okay.
solution to this.
So Lawal say rheumatologist. Lawal is saying rheumatologist. Okay, so my opinion is a respiratory physician, since he's saying a chest pain. Because of that chest pain, I think it's easier to see a respiratory physician. Maybe you can't send down to a rheumatologist. Sure, you get, but I don't know which one. What do you think?
Okay, I think so. Then if any other people is say treating a patient not be one doctor duty. Mostly when you go to teaching hospitals or FMCs, not be one doctor duty. Now duty of sometimes a multidisciplinary approach. So when the respiratory doctor see am and he need to invite any other doctor, he can actually do so.
Okay, so let me pin this comment again. She sent stars. Thank you very much. Ngozi says, thanks, Dr. Israel and Dr. Fredosta. You both are doing a great with our people. God bless you. Thank you for the stars. I see the stars. We the end now. And make I put this comment. This person says, I thought this program is by 9, yo, because they follow us. Why now? But we they put the flyer for page, we they post them, we they talk now 8 p.m. If you they follow us very well, you go see the flyer there. 8 p.m. And when it's 8 p.m. Nigerian time, when it's 8 p.m., we they start. We know they do African, we know they joke with our time. So I beg. The reason why I put this comment now because say we they end now. And so many other comments there. But if Dr. Israel one more will take comment again, I feel take up. But please, the program is 8 p.m. every Sunday by 8 p.m. This particular program, when it's 8, we start. 9 p.m. we end. No vex. Yeah. No vex.
And just 1 hour
Dr.
program.
Israel.
Now 1 hour. Now we they pass 1 hour, but always 1 hour program.
1 hour. 1 hour. Let's see. Is there anyone that needs to be addressed? I see. So sorry, guys. Let's see. Okay. So the time they up. Our time is up here. Okay. So yes, activate notification, and Facebook will always notify you. So when you want to get the notification, what you go do be this: go to my page or Dr. Israel's page. You go see one bell sign, or near my video or near my name of my page, one bell sign. Click on the bell sign, select get all notifications, so that whenever we come live like this, Facebook will just send you message. You go know, go miss them. And thank you. Yeah, Lawal, they here. Our guy, they here. Lawal, I see you. Okay, Israel, any final words as we round up tonight?
Final words is that you guys should we try to keep safe and in everything when we do, and make we also try to visit our doctor. Make we stop self-medication. I know it's not easy, but make we try, because if you stop self-medication, to some extent you go save yourself so many stress and so many expenses. Because if you don't take drug and it not work for you, you can't go hospital. Say you don't waste one money, and when you reach hospital, doctor will still tell you to pay another money. So then you have wasted some. You don't waste your finance in some ways. So make we try to stop self-medication, follow the right channel, and get the best treatment. Also, it go good make all family get your own family doctor, and get your own family doctor, so that when it come be say the family doctor no go fit handle that particular case, na him go write referral to a specialist when go see you. So when they see that kind of thing, not be you go the first time, they no go to delay yourself, delay you, because they know say somebody now they refer you, they come. So let's try and live safe and be happy.
Yeah,
Now,
this one is very important. Thank you so much, Dr. Israel. Thank you, Dr. Lawal, for joining. Thank you, everybody, for joining. Once again, our job on this platform, not just to do the little way we fit do. No be say we know all the answers. Do you understand? We get so many doctors, we know they online. We they very, very good though. No be say because we did here now, we good part. So many doctors where they I beg, wherever you find yourself, look for a doctor. Try get your doctor wherever you dey, where you go fit dey relate with, so that you know where they waste money, they spend money anyhow. Very important. And once again, I want to thank you all for coming, for watching, for sharing, for liking, for commenting. God bless you. And Ngozi Amina, our one of our greatest supporter on this platform, I want to say a very big thank you to you. God bless you all. Like I always say, good life now waiting. Good life. Good life. Nah, sense. Okay, for those who want send star, Ngozi says if you want to send star, you need to send star by using PayPal, Google account, and bank account or credit cards to allow you buy stars online. So for the person where they ask, if you want to buy stars and send on Facebook, please screenshot what Ngozi has said, or you can read it later and try. Thank you all. Have a wonderful night. Take care. Bye-bye.